Bismillahirrahmanirrahim. Assalamu alaikum. So today our topic is about the inguinal canal. Now for that you have to first think of the anterior abdominal wall as a strong wall that is protecting the abdominal organs. Now normally what happens that this wall should have no holes because holes makes the wall weak. But nature had one problem. Actually in males the testes are formed inside the abdomen during the fetal life. Now, however, sperm production requires the temperature that is about 2 to 3 degrees Celsius below body temperature. Therefore, before birth, the testes descend into the scrotum. So, during this descent, they create a tunnel through the abdominal wall, and that tunnel is specifically called the inguinal canal. So, remember, the testes descends, they leaves a passage, and that passage remains, and that is equals to the inguinal canal. Now, what happens in females? In females, ovaries never descend. So therefore, females do not need such a large passage. So only the round ligament of the uterus passes through this canal, and hence the inguinal canal is actually much smaller in the females. Now, according to our definition from the textbook of Snell's, that is the inguinal canal is an oblique passage through the lower part of the anterior abdominal wall. Now you can notice the word oblique. That means it is not straight. Then why it is running obliquely or diagonally? Why? Because nature intentionally made it oblique because a straight tunnel would allow abdominal organs to come out easily that can lead to hernia. That's why the nature has intentionally made the inguinal canal oblique. Okay, and so the oblique canal actually gives protection. Now what are the contents of this canal? So first in males. So in males the canal transmits the spermatic cord. Now you have to remember that spermatic cord is not a single structure. It is like a cable that is containing a lot of structures, you can say. So inside it are our vas deferens, testicular artery, pampiniform venous plexus, genital branch of the genitofemoral nerve, lymphatics and the autonomic nerves. These all are the contents of the inguinal canal. Now all these structures pass through the inguinal canal together in males. Now what happens in females? In females, instead of the spermatic cord, the canal actually only contains the round ligament of the uterus. So it is exactly like that, the uterus, it is actually passing through the inguinal canal and then up to the labium majus. So exactly according to which our book of the Snell states. Now why is the canal 4 centimeter long? There is about the length that is 1.5 inch. So according to the book, because a long oblique canal actually gives more protection, so a very short canal would become a weak point in the abdominal muscles. That's why the canal is actually very long. Now what is the actually direction of the canal? So the direction of the canal, this is actually a frequently asked question in the viva, and the canal actually extends from the deep inguinal ring, then it goes downward, forward and medially. That means it is actually going downward, but it is also coming forward, and its direction is also towards medial side of the body. So it is going downwards, forwards and medially. So you have to memorize these three words: downward, forward and medially. Whenever the examiner asks about the direction of the inguinal canal, only these three words are required. It goes downward, forward and medially. Now why is it called oblique? Because you have to imagine that there is a straight wall, and that is in a straight wall there is a straight tunnel. Now in the straight tunnel organs can easily pass. Now you can consider an oblique tunnel. So what happens in oblique tunnel? The abdominal pressure pushes its walls together. So this closes the canal, and this is actually a very clever design created so beautifully by our creator that it has intentionally created our inguinal canal oblique, so it prevents bulging of the hernia or the muscles of the abdominal wall. Now about its extension, it extends actually from the deep inguinal ring. So let's study about the deep inguinal ring in detail. So what is it? So it is the entrance of the inguinal canal. So, and it actually lies in the transversalis fascia. We have already studied about this in the transversalis fascia. And remember, it is not a hole in the muscle. It is actually a hole in the fascia. It is not a hole in the muscle of transversalis abdominis. It is a hole in the transversalis fascia. Now, what is position? So according to book, it actually lies about 1.3 centimeter, or you can say 0.5 inch above the inguinal ligament. That means it lies halfway between the anterior superior iliac spine and the pubic symphysis. And this point is actually very important, that where is the location of the deep inguinal ring, that it is about 1.3 centimeter above the inguinal ligament, halfway between the anterior superior iliac spine and the pubic symphysis. That means if we draw a line from the pubic symphysis to the anterior superior iliac spine upwards there, and so there will be on midway there will be the deep inguinal ring. Okay, now according to our book, there is the inferior epigastric vessels which actually pass upward from the external iliac vessels. They actually lie medial to the deep inguinal ring. So the external iliac vessels which are giving rise to the inferior epigastric vessels which are going to supply our abdominal muscles. So that these inferior epigastric vessels are actually lying medial to the deep inguinal ring. Okay. And this point about the inferior epigastric vessels, this point is actually very important when you are studying the direct and the indirect inguinal hernias, which we are going to study in our respective lectures. Now, the covering formed. So, margins of the deep ring actually continues as the internal spermatic fascia around the spermatic cord, and this is actually a very commonly asked viva question, that the margins of the deep inguinal ring are continuing as the internal spermatic fascia of the spermatic cord. Now the next is about the superficial inguinal ring, that is actually called the exit. The deep inguinal ring is the entrance of the inguinal canal, and the superficial inguinal ring is actually the exit of the inguinal canal. So unlike the deep ring, it is actually present in the external oblique aponeurosis. That means it is present in the aponeurosis of the muscle. Deep inguinal ring was present in the fascia, but it is present in the aponeurosis of a muscle. Now, according to our book, the book says it is actually triangular. That means it is not circular like the deep inguinal ring. And many students actually mistakenly imagined it as a round. So that's why it is cleared here that it is actually a triangular shaped abscess. Now, about the position of the superficial inguinal ring, so it is immediately above and medial to the pubic tubercle. Now, you have to remember that deep inguinal ring is actually lateral, and the superficial ring is actually medial to the pubic tubercle. So deep inguinal ring is lateral to the pubic tubercle. I am not talking about the actually talking about the inguinal ligament. I am talking about the pubic tubercle here. Now, why can't we easily see these rings in the abdomen? So according to our book, you have to imagine that you are wearing a glove. Now what happens that you can imagine wearing a glove and you can insert your finger inside, okay, but from outside you cannot see the openings clearly, okay. So similarly, the spermatic fascia cover the margins of both rings, therefore the openings are difficult to identify, because here our gloves are covering actually all the openings, so we cannot see the openings from the exteriorly, because openings are actually internally. We have to slide our hand inside the glove to see these openings or feel these openings. But in case of, and same goes for the capes of the deep inguinal ring and the superficial inguinal ring, because they are actually covered by the coverings of the spermatic cord, so we cannot easily identify it. Now about the walls of the inguinal canal. So about the walls of the inguinal canal, these are actually one of the most important exam questions, and you have to think of the canal as a room. Now every room has a front wall, a back wall, a roof and a floor. So exactly the same goes for the inguinal canal. So the anterior wall of the inguinal canal is actually formed by the external oblique aponeurosis, and laterally it is reinforced by the internal oblique. Now why laterally it is being enforced by the internal oblique? Because posterior wall is weakest laterally. So nature strengthens the opposite wall. That's why the posterior wall is actually getting weak laterally. So that's why the nature has inserted internal oblique muscles laterally for its reinforcement. That's the anterior wall, abdominal wall doesn't appear weak. Now about the posterior wall is actually formed by the laterally it is formed by the transversalis fascia, and medially it is formed by the conjoint tendon. Now again notice the design, superficial ring is medial, okay, remember, and the anterior wall becomes weaker there on the superficial ring. So therefore the posterior wall becomes stronger using conjoint tendon. That's why the creator Allah subhanahu wa ta'ala has inserted a conjoint tendon to cover the hole that is created by the superficial inguinal ring. Now about the roof of the inguinal canal. So roof actually you can see the inferior wall made by the arching fibers of the internal oblique, and the transversus abdominis. See, actually these fibers curve over the canal like an arch. We have already studied this point when we were discussing the muscles of the anterolateral abdominal wall. So if you haven't taken that lecture, I will recommend you to first take the muscles of the anterolateral abdominal wall, or either you can immediately watch, but you have to immediately watch the lectures about the muscles of the anterolateral abdominal wall if you want to learn about the inguinal canal in conceptual manner. Okay, so next about the floor of the inguinal canal. So actually the floor is made by the inguinal ligament, and medially it is reinforced by the lacunar ligament. Okay, it is actually made by the inguinal ligament, but its medial reinforcements is by the lacunar ligament. Now if you want to know some mnemonic to easily learn about the walls of the inguinal canal, so there is a mnemonic that is MALT, 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 that is commonly used by the medical students for learning the inguinal canal. So M is equals to the muscle arch, and muscle arch is forming here the roof. Now A is equals to aponeurosis, and aponeurosis is anterior, anterior aponeurosis. Now MALT, L is equals to ligament, and ligament is actually forming the floor. So ligament, floor, and T, MALT T is the transversalis fascia, and the transversalis fascia is the posterior or lateral, you can say. And then you can just add conjoint tendon, that is equals to the posterior medial, because the transversalis fascia is posterior laterally reinforcing, and the conjoint tendon is present posteriorly but medially. So that is a mnemonic MALT to learn the walls of the inguinal canal. Now how does the body protect this weak area, or you can say why is the inguinal canal weak? Well, because I am quite a lot of time mentioning that it is making the anterior abdominal wall weak. That's why we are needing the muscles for its reinforcement, the tendons for its reinforcement. So actually the question is, why is the inguinal canal weak? So actually it is naturally a weak area because there is a tunnel passing through the abdominal wall, and we all already know that every tunnel weakens a wall. Hence the most abdominal hernias actually occur here in the inguinal canal. Now how does the body protect this weak area? The question is that. So according to our book of the Snell's, that there are actually 5 protective mechanisms, and they are actually very, very important. So the first is about the oblique course. Now deep and the superficial inguinal rings are not opposite to each other. Therefore organs cannot pass directly, because if they will be opposite, then the organs can easily direct downward, like straight, they can direct downward through the inguinal canal. But the creator, Allah subhanahu wa ta'ala, has created its passage obliquely, that now the deep and the superficial inguinal rings, its 2 openings are not straight in the line. That's why it is actually providing a kind of halt or resistance to the movements of the organs through it. Now outside, the second point is about the internal oblique reinforces the anterior wall. The fibers that lie in front of the deep ring, they strengthen the weakest area, and hence they are actually providing against the inguinal hernia. And the third main mechanism that is actually protecting against inguinal hernia, or you can say reinforcing the inguinal canal, is the conjoint tendon reinforces the posterior wall. And these conjoint tendon actually lies behind the superficial inguinal ring, and hence they are again strengthening the weakest area of the abdominal wall. And the next mechanism is that how it provides the protection against inguinal hernia is through the muscle contraction. Now actually the muscle contraction, what happens that the muscle contraction closes the canal. When you cough or you strain, or you can say you lift heavy objects or you defecate, the arching fibers, now what happens, the arching fibers of the internal oblique and transversus abdominis that are then going to form the conjoint tendon, they actually contract, and then they descend toward the floor. So actually this curving and contracting compresses the spermatic cord, and the canal becomes almost closed. So that is exactly what the figure here is suggesting, that when the muscles are relaxed, so the canal remains open, but when the muscles contract, the arching fibers descend and they compress the canal and nearly they obliterate it. Okay, so I am going to show that contraction of the muscles by a picture of Snell, because it is not depicting here correctly. Now here in this picture you can actually visualize which I was saying, that here this is the actually the inguinal canal below the conjoint tendon, and these are the fibers of internal oblique, and above them we have the fibers of transversus muscle, and then this is the superficial inguinal ring through which the spermatic gourd is actually exiting. Now when the muscles are relaxed, you can actually say that the inguinal canal is actually opens, it remains opens, but when the muscles contract, this conjoint tendon, it contracts, it actually here you can see the roof is coming downward, and it actually closes, kind of closes the inguinal canal. Here the inguinal canal is open, and here the inguinal canal is actually constricted or closed. Now let's come back to where we were. Now the fifth mechanism for its defense is actually by the squatting, that the squatting protects the canal. Now during strong or straining such as defecation or during the childbirth, people naturally squat. In the squatting position, this is the squatting position shown here. So in the squatting position, the thighs pressed against the lower the thighs actually press against the lower anterior abdominal wall, and this provides extra support to the inguinal region and reduces the chance of herniation. Okay, that is shown here. Now there are some high yield viva questions that we have been we can deduce from this topic. Are the first is the define inguinal canal. So inguinal canal is an oblique 4 cm passage in the lower anterior abdominal wall extending from the deep inguinal ring to the superficial inguinal ring. Then its content in males, is spermatic cord, and its content in females is the round ligament of the uterus. Now the deep ring is present, so the deep ring is present in the transversalis fascia, and the superficial ring is again present in the external oblique aponeurosis. Now the deep ring lies lateral or medial to the inferior epigastric vessels. So actually the deep ring lies lateral, the vessels are actually medial to the ring. So deep ring lies lateral to the inferior epigastric vessels. And if there is a question about the covering formed by the deep ring, that is the internal spermatic fascia. And there is also a commonly asked question about the covering that is formed by the superficial inguinal ring. So superficial inguinal ring continues as the external spermatic fascia. That is actually the external covering of the spermatic cord. And another commonly asked question is about the length of the inguinal canal. So approximately the length of the inguinal canal is 4 cm. So if we summarize our topic in just 2 to 3 lines, so the inguinal canal is actually a 4 cm oblique passage in the lower anterior abdominal wall that transmits the spermatic cord in males and the round ligament of the uterus in females. Now it extends from where? It extends from the deep inguinal ring in the transversalis fascia to the superficial inguinal ring in the external oblique aponeurosis, remember. And then its walls and oblique course is providing protection against the inguinal hernias, because this point is actually weak in the abdominal wall. So that was all about the inguinal canal. The next, inshallah, in the next lecture we are going to study about the embryological notes of the inguinal canal. That is actually a part of your gross anatomy in the UHS curriculum, and that is about the inguinal canal development. So you immediately go and watch the lecture about the inguinal canal development, so that is the both these topics combined, and the memory become reinforced in your mind. And if you like the video, comment, share, do share your reviews, and do share it with your fellows and friends. Thank you so much. Allah Hafiz.